So I'm going to talk about another field that is studied here at the Garvan that also we do genomics with with this disease, but also a lot of other studies that aren't quite as common at the Garvan because they're not lab-based, it's all people-based. So just briefly, osteoporosis is just from the Greek word from osteo means bone and porosis means pores. So that nice kind of structure, scaffolding that you have in your bones breaks down and becomes more porous. And so it looks a bit more like this. You can see the pores breaking down. And the problem with osteoporosis is that it makes it much easier to fracture. So if you just fall, and even some people who don't fall or just turn around, if your bones are that osteoporotic, they break easily. So why are we calling this Darlo to Dubbo is because we have a outreach study in Dubbo. There's actually been going since 1989. It's one of the largest, longest running studies of its kind in the world, because as you can imagine, it's hard to get people to keep coming over years to be studied and give their time. But we have had 4,820 subjects, which is huge, and people come every 2 years for a visit, and at that visit they have bloods taken, all their history, their medications, whether they've been in hospital, and a whole lot of lifestyle factors are gathered, what sort of exercise they do, what their diet's like. And so there's things that you can learn over time that you can't possibly learn just by seeing people once. So if someone gets sick, you've got questionnaires and all information, blood tests from what they were like 10 years ago. So you can see whether there's certain things that predispose people to get different sort of illnesses or fractures. And you can only do that in these kind of long-term studies where people come back over time. So we have 3,820 blood samples. So at the moment, vitamin D is a very hot topic, and people are wondering whether vitamin D, having low levels, might predispose you to diseases. So with this sort of study, you can see when someone's sick, you can see whether they had a low vitamin D 10 years ago or 5 years ago, whether it's something that might be associated with them getting sick, or it's just something that happens when people get sick. So it's not something that if you fix it 10 years beforehand, it'll help you not get that disease. So with this welfare long-term studies, we've concentrated on osteoporosis, but there's lots of things that you can, lots of really relevant clinical information you can get because people have been coming over all these years. So we have 150 published articles, and I'm just going to show you, this is an attempt at the world's longest Congo line in Dubbo, and these are participants in the study, and it's part of a fundraising effort. So the Dubbo Epidemiology Study has become a huge part of that community because most of the people over 50 come and every 2 years, and the nurse that's been running this, Janet Waters, was the most amazing woman, and it's part of the reason why it has one of the lowest dropout rates, only about 5 to 8%, because no one wanted to let her down. So often it's the people and that kind of connection that really keeps these sort of studies going. So this is 2 men who are part of the study, and one of the big things that have come out of the Dubbo study is how important osteoporosis is in men, because we know it's 3 times more common in women, but it's still very common in men. And the consequences of fracture for men are actually worse than for women. So they have more disability and a high rate of mortality after fracture, and that's one of the findings in this study. So here's another fundraising effort. So you can see there's a large proportion of the community that are part of this. So these are just some of the biggest findings that have come out of our study over all these years. So it's an extraordinary statistic, but 25% of people over 50 die in the year following hip fracture. So it's not necessarily the operation, which you might think is an incident that might cause things. Something happens in that year after, and what the mechanism is part of what we're looking into that makes people much more susceptible to die. And also we know that hip fractures, even if it doesn't increase people's mortality and they survive, it's one of the main reasons people go into nursing homes. So that's why we're really trying to find out as much as we can about preventing fractures for a whole lot of reasons. And I also do clinical trials here for new treatments for osteoporosis. So hopefully we'll have better things on the horizon to help people with osteoporosis. So from the study and all the statistics we've gathered at Dubbo, we've been able to produce what we call a fracture risk calculator. So it's there on the Garvan website. You just have to look or go through Google, Garvan fracture risk calculator. You only need 5 fields, and it tells you what your risk of fracture is in the next 5 years and the next 10 years. And that helps you decide if you're very high risk, maybe you'd like to go and see your GP. If you're low risk, it might make you less nervous about osteoporosis. And that's the sort of thing I've been doing to integrate this fracture risk calculator to software. So when you go and see your GP, all the necessary fields and things he or she needs to know about osteoporosis is there, and they can tell you what your risk of having a fracture is in the next 5 or 10 years, how that risk compares to people just of your own age in the population, and how that risk will change with treatment. So a lot of different useful clinical applications come out of our outreach post in Dubbo, for which we're very grateful, and especially to all those people who give their time to that study.